Welcome to World Laparoscopy Hospital. Today we will discuss about overview of preoperative and post-operative requirement for laparoscopic cholecystectomy surgery. Laparoscopic surgery, also known as minimally invasive surgery, is a surgical technique that involves making small incisions in the abdomen and using specialized instruments to perform surgical procedures. Preoperative and post-operative care are essential aspects of ensuring a successful laparoscopic surgery. Here's a general overview of preoperative and post-operative care for laparoscopic surgery.
First, we will discuss about preoperative care before any laparoscopic surgery. Preoperative care before any laparoscopic surgery is important to ensure a safe and successful procedure. This includes a medical history and physical examination of patient should be done to assess overall health and identify any potential risks or complications. Blood tests to check CBC, LFT, KFT, PT-INR, electrolytes, and other levels as comorbidity of patient needs should be done. A chest X-ray and ECG is also required to check for any lung and heart problems. A bowel preparation to empty bowels and reduce the risk of infection is also required. Alternative to bowel preparation, you can ask your patient to take only clear liquid prior to the night of surgery. You should give instructions on how to prepare for surgery, including what to eat and drink, what medications to take, and what to expect on the day of surgery.
Indocyanine green, ICG, is a dye that is used to visualize the bile ducts during laparoscopic cholecystectomy. It is administered intravenously and is absorbed by the liver. The dye then travels to the bile ducts, where it is excreted into the bile. The bile ducts will then fluoresce when exposed to a special light. This allows the surgeon to see the bile ducts clearly and to avoid damaging them during surgery. ICG is typically administered 30 minutes to 1 hour before laparoscopic cholecystectomy. The dose is usually 2.5 mg for adults and 0.5 mg for children. The dye is administered through intravenous in the arm or hand. There are a few things to keep in mind when administering ICG. ICG should not be given to patients who are allergic to it. ICG can cause a temporary increase in liver enzymes. ICG can cause a temporary decrease in blood pressure.
Before undergoing a laparoscopic cholecystectomy, several pathological investigations may be recommended to assess the patient's overall health and to gather specific information about the gallbladder and associated conditions. Common blood tests may include liver function tests, such as liver enzymes and bilirubin levels, complete blood count, CBC, and inflammatory markers, such as C-reactive protein or erythrocyte sedimentation rate. Imaging studies. Various imaging techniques are used to examine the gallbladder and surrounding structures. These may include ultrasound, magnetic resonance cholangiopancreatography, MRCP, computed tomography, CT scan. Other tests, depending on the patient's specific condition, additional pathological investigations may be recommended, such as HITA scan. A HITA scan, hepatobiliary immunodiacetic acid scan, can evaluate the gallbladder's functioning, bile flow, and identify any blockages or abnormalities. Endoscopic retrograde cholangiopancreatography, ERCP may be performed in cases where there is a suspicion of common bile duct stones or other biliary tract abnormalities. It's important to note that the specific investigations recommended may vary based on the patient's individual circumstances.
Just before laparoscopic surgery, the anesthesiologist should confirm the patient's identity and allergies. He should review the patient's medical history and surgical plan, assess the patient's vital signs and airway, administer pre-anesthetic medications to help the patient relax and prevent pain. He will place an N4 line to administer fluids and medications and place a breathing tube to help the patient breathe normally. Anesthetist should monitor the patient's vital signs and oxygen levels. He will administer anesthesia to keep the patient asleep and pain-free during surgery.
Post-operative care after laparoscopic cholecystectomy. After the laparoscopic surgery, patient should be taken to a recovery room, where vital signs will be monitored as the effects of anesthesia wear off. Few patients may experience grogginess, nausea, or mild pain during this period. We should provide appropriate pain medication to manage any discomfort. It is important to communicate with patient to ensure effective pain management. Initially, after few hours of surgery, patient need to limit strenuous activities and gradually increase them as advised in several days. Patient's diet may be gradually advanced from clear liquids to a regular diet as tolerated. Most of the patient will be discharged same day in evening or very next day of surgery. Patient should have scheduled follow-up appointments with surgeon to monitor your healing progress. After 9 days of surgery, we can remove any sutures or staples and address any concerns or complications that may arise.
Thank you for watching this video created by the IT team of World Laparoscopy Hospital. This video was generated using artificial intelligence, and we hope you enjoyed it. We appreciate your patience. Thank you.